Hello, I'm Janine Kakmar with PHTV Channel 4, Palos Heights, and we're back with our show, Healthcare Experts in Your Corner. Today we have with us Nancy Lynch. Nancy is a licensed clinical professional counselor and a board-registered mental health and substance abuse counselor, and for the past 12 years has worked as an addictions counselor at Palos Health, which is Palos Hospital here in town. Nancy's witnessed an increase in people with opioids use disorder and has seen the impact the epidemic has had. So Nancy, I'm glad you're here with us today to talk about it. Yeah, when we talked before, you said some of your goals were to increase the understanding around substance use disorders and to reduce the stigma associated with them, and to provide information, resources, and support to the affected individual, family, and community. Mm-hmm. Okay, yes. So that's what we're here to talk about. We're going to be talking about the epidemic of the opioid use, and so why don't we start from the beginning? Like, can you tell us what are opioids and that we're hearing about all the time now?
Okay. So opioids are a classification of substances that are related to the opium poppy plant.
Okay.
They include prescription medications for pain, which are things like Vicodin, oxycodone, morphine, fentanyl, Dilaudid, and also the illegal substance heroin.
Okay.
And they're used primarily for pain management, but they also have very strong euphoric effects, so they produce a high in the person who's using them, mm-hmm. and that makes them very susceptible to abuse. About 20 to 30% of the people who use them misuse them, okay. taking them either when they're not needed or taking more than is needed, and also susceptible to things like dependence and addiction.
Mm-hmm. How did we get to this to be such an epidemic?
Well, in the late 1990s, the pharmaceutical companies began really aggressively marketing these substances for things that they had never been used for before. So in the past, they had been primarily used for things like end-of-life pain or cancer pain.
Okay, so really severe.
Right, mm-hmm. severe pain. And then they began being marketed for things like osteoarthritis or chronic back pain, things that were much more common. So there was a great increase in the number of prescriptions that were being written, and with that there was an increase in the number of people who were abusing them, who were becoming addicted, and who were dying from these substances.
Mm-hmm. And this is something that many of the people weren't even aware of, that they were so addictive. Is that right? I mean,
right. They were being marketed as relatively safe, benign substances mm-hmm. that did not have the high potential for abuse that we now know that they have, mm-hmm. and also being marketed as being more beneficial for chronic long-term pain than we now know they are. We know that they're not particularly beneficial for long-term pain.
They're not?
Not,
mm-hmm.
right. Not as effective as they were being marketed.
So this covers, I mean, based on the usage that you talked about just now, this can cover a whole range of people, all ages, all walks of life.
Absolutely.
Professionals, non-professionals, whatever.
Right.
So who gets addicted?
Well, we know that anybody can become addicted. So
anybody?
Anybody can become addicted. So especially with long-term use and with misuse, as I said, people are much more likely to become addicted. We also know that there's certain factors. Genetics is a factor in who becomes addicted. We know that people who have family members who are addicted are much more likely to become addicted to substances, and people who themselves are addicted to other substances like alcohol or cocaine are much more likely to become addicted to opioids.
Okay. Mm-hmm. So how do you know that, I don't know if this is a silly question, but how do you know if you're addicted to something?
Well, the way that we talk about recognizing addiction is that if you're using a substance, again, in ways that it's not intended, mm-hmm. More than you intended to use, if you continue to use it despite the fact that you're having negative consequences to it. So again, people who have substance use disorders are very often using it despite the fact that it's causing problems for them financially or legally or in their relationships. Mm-hmm. If you're having trouble stopping it, if you want to stop and you're unable to, that's a sign that you have become addicted to a substance.
So what does someone do then at that point,
Well, most people are going to need some help, especially with opioid use disorders, people who are using opiates. There is a very painful, uncomfortable withdrawal that goes into effect when they try to stop using them on their own.
Really?
Yeah, so they would have things like nausea, cramping, body aches, a lot of gastrointestinal issues. They say it's like the worst flu that you ever had or can imagine. Yes.
Really?
So that's the reason that a lot of people are unable to stop on their own, because when they have those symptoms, they take the substance because they know that'll make the symptoms go away.
Got it.
So they get into this vicious cycle of wanting to stop and not being able to. So usually people are going to need some kind of help to get off of substances.
You know, and you mentioned as one of your goals, you wanted to reduce the stigma associated with opioid abuse or opioid substance abuse. And I could see just from what you're talking about how, you know, if someone finds themselves in a dangerous loop like that where they want to stop but they can't stop or whatever, and then how do you get to reach out, you know? How do you do that? How does one do that?
Right. We know that only about probably 1 in 10 people who need treatment will get it, and part of that is because of the stigma that's attached to it. So if you have...
The stigma being?
People thinking of, especially opioid users, heroin users certainly, as bad people, degenerates, having a moral weakness. We know that this is a chronic brain disease. You know, it is a health condition like other health conditions, but because of the stigma attached to it, people are not as likely to reach out for help as they are with other health conditions.
So addressing that would help more people to seek treatment or to feel better about going to get treatment, something like that.
Absolutely, right. So the more that we can get it out there that this is a brain disease, you know, that there's nothing to be ashamed of for having that anyone, as you said, can become addicted to it. It doesn't matter your socioeconomic group, your morals, none of that is involved in becoming a person with a substance use disorder.
Okay.
That it is a health condition and it needs to be treated as one.
Okay, so you being an addictions counselor at Palos Health, you see it from one side. So how does one reach out to you or reach out for help in general?
Okay, so we do have someone can call the hospital. The 2 ways that people usually get involved in treatment is they either make a phone call to the hospital, or you can just walk into the emergency room and tell them, you know, that you're having trouble stopping these substances, that you've tried on your own. Most people have tried many times on their own before they come to the hospital, and let them know that you're wanting help.
Really?
Yeah.
There's no, I don't know, result or anything about them getting in trouble or anything like that? Or?
Not at all. No.
Okay.
Yeah, there's not going to be any legal consequences to going in and seeking help because, again, this is a medical condition that they have.
Okay.
So either one of those ways. They
so
can
we'll have
call.
that number posted on the screen behind us, a phone number that they can call, or you can go to the emergency room or go ahead.
Yeah. So people go to the emergency room, and that's usually, when you go to the hospital, that's usually for what's called detox, which means that they're going to be medically managed for relieve those withdrawal symptoms. Like I say, the withdrawal symptoms are what very often interfere with people being able to stop on their own.
Okay.
So they can go into the hospital for a couple of days.
I was going to ask, how long does that take? Does it depend on the individual?
Depends on, obviously, their physical health. If they have no other physical problems, it usually is just a couple of days that they can go in and be given medications to help ease the symptoms of the withdrawal. They can be monitored for their blood pressure and things like that to make sure that they have a safe and smooth withdrawal.
So we know that these medications that they're being given are also not addictive medications, right?
Exactly.
So kind of defeating the purpose, right?
That's right.
So once they go through what you say is detox, then where does treatment go from there?
Right. It's important that people not just stop at detox, because that can be kind of a revolving door where people go into the hospital, they get off the substances, then they go back out, and they're at a very high risk for overdose at that point because their tolerance to the substance has changed when they've stopped using.
Oh, geez.
So the same amount that in the past may have gotten them high may now be able to be life-threatening or kill them.
Okay.
So it's important that they get a long-term care. Again, this is a chronic illness that needs long-term care. We know that people who stay in treatment longer do better. So when people come out of the hospital from a detox, they usually are referred over to the center where I work, which is the South Campus in Orland, and they will come for what's called intensive outpatient treatment. And intensive outpatient treatment is 3 days a week, 3 hours a day. We meet on Monday, Wednesdays, and Fridays, 3 hours each day for counseling, where they learn how to identify what their triggers are, either learning to avoid those triggers or dealing with them in different ways. They learn to manage stress. They learn a lot of coping skills that they may not have. And then they also are given what's called medication-assisted treatment.
Okay.
And medication-assisted treatment is a form of treatment that we know to be more effective than other treatments. And that means that they're given, we have a doctor on staff now, Dr. Spishikoff, who is an addiction specialist, who can prescribe medications that can help with withdrawal, with cravings, those kind of things to make it easier for people to stop.
Okay, and you said, so this is something that you meet every day at the same time for how long?
We meet three days a week, so Monday, Wednesdays, and Fridays, for 3 hours each day, approximately. And that can go anywhere from, we would say, 6 to 8 weeks usually is typical.
Okay.
Some people stay longer depending on how they're doing. You know, some people struggle with relapse or with being able to stop. Other people, do better with that, and so they don't need to stay as long. But 6 to 8 weeks is usually typical. And then after that, we step people down to what's called outpatient treatment, where they would come once a week for a recovery group.
Okay.
That's usually an hour and a half once a week.
Okay.
And that can go on for as long as they need it. Some people come to those groups for years.
Okay. So now people are busy. They still have to do their jobs because this is an outpatient. You go back home after your treatment or after your sessions. And so how can they fit that in their work schedule? Is it times that are flexible for them?
We have two different programs. So we have an afternoon program that meets from 12:30 in the afternoon till 3:50. And then we have an evening program which works 6 to 9. So a lot of our people who are working come to that evening program.
Okay. So
some people would take a medical leave or something to be able to complete treatment or reduce their hours at work, but many people work full-time and continue to come to our evening program.
So it sounds like they can work into their day and so they can take care of what they need to.
The other option that is available for people is residential treatment. So some people come out of detox at the hospital and go right into a 30-day or 28-day program for long-term residential treatment where they live there.
I see. Where is that at?
There's a number of agencies that Payless works with. Payless does not offer residential treatment,
but you
there's
guys
a
can
number
recommend
of
it.
community agencies that we can recommend.
Okay, wonderful. Okay, so we're talking basically about the person who's dealing with an addiction. What about their family and their loved ones who are with them? What kind of resources do you have for them?
Well, we offer family involvement in treatment whenever someone is involved in our treatment programs in intensive outpatient or outpatient. We have family education groups that we offer. We also have family meetings, one-on-one, that we do with family members. Families are very important in treatment. We know that a lot of people come to us because of their family have encouraged them to get treatment, and that's what we would encourage families to do. If they have someone who has this substance use disorder, is to talk to them in a supportive way about the fact that they feel that they have an issue and that they need help for it. There also are community mutual support groups out there for families that include Narcan, Al-Anon, that people can access for support with other family members who are going through the same thing. Families Anonymous groups are important.
And so those are meetings that are held around town, Orland or Palos, or
absolutely,
and people you would give them ways to contact or when to find out where meetings are and that kind of thing.
Right. We give when people come with us, we give them a list of those meetings, Al-Anon meetings in the area, and Narcan meetings in the area. We also encourage families, if you do have a loved one who has an opiate use disorder, to have Narcan, which is the rescue medication, so that if someone does have an overdose, you can give that medication to them and revive them so that they can go on to have treatment, because very often overdoses happen in the home. And so it's important for family members to have that rescue medication on hand.
That's something I was reading about recently, that's something that a lot of the EMT people have used or have had an increase of use for that, and is that becoming more readily available now, Narcan?
Right, it's readily available without a prescription. You can go to the pharmacy, and get that. Again, people who are in our program, the doctor prescribes Narcan to the family member so that they can have that available should it be needed. Okay,
all right. How does one, as a family member, if you see someone that you think is in trouble, is there what can you do for them? I mean, you can't make them go to treatment.
Right.
Is there any help for them in that aspect where they're not necessarily their loved one's not being treated, but they sense trouble? Is there anything you could do for them before that, or?
Yes, again, families can call us if they want to, and we can try to help walk them through the process.
So even though if they don't have someone in treatment yet, a family member could, that's good to know.
And we also have outpatient counseling for family members that they can come and talk to someone and try to, make some decisions about what they need to do to protect themselves, because again, addiction affects everybody in the family, not just the person who's using. So they can talk to an outpatient counselor if they feel that that would be helpful. Again, a support group is usually very helpful. We encourage families to educate themselves about addiction and recovery, to really understand, how this disease works, so that they're not blaming themselves, which a lot of families do, think that somehow it's their fault. And as you said, families can't control someone's use, but they can be very instrumental in getting people into treatment. They say around the program, they say that it's your liver, your lover, or your lawyer that gets you into treatment. And so many of the people who come to us came there because a family member, was telling them they needed to get help and recognizing the signs that they were in trouble.
You just mentioned the liver and stuff. So this is not just, these resources we're talking about aren't just for opioid use, but any substance abuse, like alcohol or...
Yes.
Correct? Okay.
Yes.
All right. What else is there? Is there anything else you'd like that we need to let people know for?
Well, I think the important thing that I think it's important for people to know is that there is recovery is possible. I think very often we hear about the tragedies on the news every day. We hear about the 115 people in the United States every day who die from an opiate overdose, and that is tragic, and it's important for us to understand that. But it's also important to understand that many people recover from this illness and go on to live happy, healthy lives. Substance use in general, there are 23 million people in America who are in long-term recovery from substance use, so it is possible. And I think it's important for people to know that, families and people who suffer from the illness itself.
Okay. So, and then we're on the slide behind us, we're going to have information of where people can go at paloshealth.com under the Behavioral Health tab for information about the resources we were just talking about. And there'll be a phone number for anyone to contact who has information, would like more information about it. And there's also a mental health and substance use assessment online, is that correct?
Right, on the paloshealth.com website, there is, you go to the behavioral health page, and you can take an assessment to see if you have an issue with substance use disorder or a mental health disorder. Again, many people who have mental health disorders of anxiety or depression are much more susceptible to developing a substance use disorder also to deal with those issues.
Oh, okay.
So it's important that you recognize if you have those.
Okay. All right. Well, Nancy, I really appreciate you coming out today to talk about and to share with us in the community all these resources that we do have available for this. Again, you can go to paloshealth.com, go to the Behavioral Health tab for more information on this, or you can call the number that's going to be on the screen as well. So, Nancy, again, thanks for coming out.
Thank you.
Thank you all for watching today. We'll see you next time.